Namaste and welcome to HCG. Today we are going to talk about preventive oncology. This is Dr. Vinod Ramani, who is our consultant preventive oncologist.
Hi, this is Dr. Prabhu Nisargikar. He is an upper GI oncosurgeon as well as a bariatric surgeon.
So welcome. So today we are going to talk about preventive oncology. So Dr. Vinod, can you just let the audience know what preventive oncology is all about?
We provide preventive services in the field of oncology. There are various levels of prevention. To begin with, there is a primary level of prevention. We look at the risk factors and how to avoid these risk factors. Then comes the secondary level of prevention, which gets into the diagnostic investigations, the other modalities of treatment. Then comes the tertiary level of prevention, where the pathogenesis has progressed and high level of treatment is essential for such cases.
That looks very complex for the local audience to understand.
Well, you can explain in layman terms if you have analogies.
Do you accept that cancer is like an accident?
Yes.
Okay, so what I say is cancer is almost like an accident. So we all have cars. So the primary level comes when you buy a new car, you look after your brakes, you look after your engine, make sure you don't have an accident. That's primary. Secondary comes when you take your car for regular servicing, because you want to pick up smaller nitty-gritties in your car so that there's no accidents. When you're braking, it doesn't happen. Now, we as humans don't get any service done, and that's where the fault lies.
Yes.
And the tertiary thing comes when you actually have an accident, what we can do to limit the damage to the car, and we start moving forward.
Absolutely.
So that's the correlation we try to use for preventive oncology. Now let me know, so is preventive oncology, what do we cover in HCG?
It's a multimodal approach.
Okay.
To begin with, we want to build awareness for the beneficiaries. The various modifiable and non-modifiable risk factors, looking at smoking, alcohol intake.
It's a very fair point, because there are loads of ads which go on TV about smoking and alcohol.
Right.
But people know about that, but there are so many new things coming out like obesity, which is now the #1 cause of cancer.
Definitely.
Which people may not be aware, and this is what we're going to highlight as part of a multimodal approach, right?
Definitely. Then we are also looking at other modes of intervention, like specific protection against viruses.
Okay.
Human papilloma virus is an etiology for cervical cancer.
Okay.
So we are looking at HPV vaccines for young adults.
Okay.
Then we have this hepatitis B virus, which is a risk factor for liver cancer.
So fair
So
enough,
we are looking at HPV virus vaccination for
Okay.
healthcare professionals also,
Okay.
and the beneficiaries.
Okay, and there's also some screening programs you're talking about?
Right, we have certain screening programs, and
Okay.
then clinical assessments and lab investigations. You can suggest some screening programs.
So like worldwide or even in India now, so for women especially, we have for cervical cancer we do pap smears. For breast cancer we have mammograms done to pick up the cancers. For the gastrointestinal cancers we have endoscopies.
Right.
And these are all part of the screening programs as such, which are very important and relevant.
Right, your focus has been on women per
Sorry
se.
for that. Yes, that's true.
Well, even men need to undergo screening tests.
Okay.
There's prostate cancer among men, and there's a simple blood assessment of PSC, which can be an indicator for prostate cancer.
Okay.
Then there are imaging modalities for lung cancer.
Okay.
So we cover all of these issues.
Okay. As part of screening program, obviously it's quite an advantage to pick up the cancer very early.
Right.
So in our, as a surgeons, we always say, the early bird gets the seed. So, for example, in breast cancer, if you look at the statistics, when you do screening program, you pick up early cancer stage 1.
Right.
It's almost curable disease. People can live long as a normal life. As the moment it spreads to local region, then the survival drops.
Right.
Similarly, in gastric cancer, if you're stage 1, the survival figures for up to 5 years is up to 70% survive. But the moment there's spread seen, they drop to almost 5%.
Right.
And that shows the focus that we have to act early in diagnosing and preventing cancer.
Right, that's the whole concept of screening.
That's true. And even the cancer symptoms, if the
Right.
public wants to know about cancers, they're quite vague, right?
Right. Breast cancer, as you mentioned about, it starts as a small lump or a nodule, and the lady may not be able to appreciate it. So we have imaging modalities for that.
Okay.
And then stomach cancers, it could be due to an infectious cause, and repeated refluxes can also cause stomach cancers.
I know.
And then we have scopes for detecting that as well.
Very fairly said. Our Indian public, they always put the family first and the work first, and they try avoiding and they ignore this very common symptoms you get with cancer
Right.
for a very long time. And this is what we're trying to focus to say, if you have any of these problems, please come to a clinic.
Right.
And we do come. So if they come to a clinic, when they eventually make up their mind, what sort of scope of services are preventive oncology clinic will going to cover?
Right. Various approaches in terms of the clinical assessment to begin with, and then the screening tools that we have, the
Okay.
robust tools that we have. And then we also look at de-addiction services,
Okay.
and then weight loss clinics, and then we are also looking at yoga therapy, genetic assessment,
Okay.
and I think you can advise them about the screening packages that we have.
I think, from HCG, we have got a 3-decade experience of being almost the national leaders in cancer care. And I think once we have had a discussion, we think we are now launching some exciting packages going forward. One of the packages called the 2-hour cancer check, which is specifically aimed for both men and women to pick up the top 10 cancers. And we hope in SCG, with such a multidisciplinary fantastic team we have, we're able to pick up these cancers and treat them early. So the motto in HCG is that we not only treat the patient, but also treat the family.
ರೈಟ್. ಸೊ ನಮ್ಮಲ್ಲಿ ಆರೋಗ್ಯ ತಪಾಸಣೆ ಬರೀ ವ್ಯಕ್ತಿಗೆ ಮಾತ್ರ ಅಲ್ಲ, ಇಡೀ ಸಂಸಾರಕ್ಕೆ ನಾವು ಆದ್ಯತೆ ನೀಡ್ತೀವಿ. ನಮಸ್ಕಾರ.
And that's from the HCG Oncology. Thank you very much.
Thank you.